Hello and welcome to Health Digest, your go-to platform for news, analysis, and development on everything that concerns your well-being. I'm Ogom Ezidimbo. In today's episode, we'll delve into the importance of preventive healthcare, the strategies for maintaining a healthy life, and the vital role awareness plays in reducing disease prevalence, especially in our communities. But first, let's bring you our health news.
On health news today, Nigeria is on the verge of a major public health crisis as antimicrobial resistance AMR continues to rise, making the country one of the worst hit globally. Experts warn that without urgent intervention, AMR could lead to widespread untreatable infections, increased mortality rates, and significant economic losses. A certified infection disease expert, Dr. Mary Alex Welle, raised concerns about the country's high AMR-related mortality rate during the opening of a 5-day training and capacity-building workshop for journalists and stakeholders on AMR advocacy and media reporting organized by the Fleming Fund Grant Phase 2 with funding from UK Aid. She stated that Nigeria ranks 19th out of 204 countries surveyed for AMR-related deaths, with 263,400 fatalities annually, 64,500 of which are directly caused by resistant infections. Now, beyond the human toll, AMR is projected to cause economic losses of up to $100 trillion worldwide, with a 3.8% decline in GDP and disruptions in livestock production. AMR occurs when bacteria, viruses, fungi, and parasites develop resistance to antibiotics and other antimicrobial drugs, rendering treatments ineffective. This leads to prolonged illnesses, higher healthcare costs, and increased mortality rates. The Coordinating Minister of Health and Social Welfare, Professor Ali Pate, has announced that Nigeria is actively fortifying its healthcare system through the strategic use of domestic resources. He highlighted this during the press briefing while addressing recent global financial aid shifts. Professor Pate emphasized that Nigeria had anticipated a reduction in international aid even before the US government formally announced its funding cuts to agencies that assist developing nations. Now, despite these challenges, he expressed profound gratitude to the United States for its long-standing support, which has played a critical role in the country's healthcare advancements. The Nigerian government has reinforced its focus on strengthening healthcare systems, increasing domestic funding, and fostering partnerships to improve health services and biosecurity across Africa. That's it on Health News. I am Chidera Esudui.
And if you're just joining us, the program is Health Digest, and we are focusing on preventive healthcare. My guest today is Maurice Atula, Chairman of Atula Health Service, and also I have Victoria Briggs, who is also of Atula Health Service. And together we will be exploring pressing health issues affecting Nigerians, including the state of primary health care, preventive care, and the role of public-private partnership in strengthening the health system. Thank you so much for joining us.
Thank you.
And thank you, ma'am, for coming.
Thank you.
Now, you are someone who is into community services,
Yes.
providing healthcare for people, especially those in the communities. How would you assess our primary healthcare system?
Yes, Nigerian primary health system faces significant challenges. That is number one. and ranging from underfunding and inadequate infrastructures, okay, to shortage of skills personnel. These are part of and this limit its reach in underserved communities. Because of these three major combined factors, at least inadequate infrastructure, of shortage of skilled personnel, it limits its reach to underserved community. However, there are promising initiatives underway to strengthen sectors and local communities, because the government can't do it alone. They have to establish a stronger partnership with private initiatives. That is the only way any local community, okay, can tap into the existing potential and create a more responsive, equitable system that truly serves every Nigeria.
Victoria, what does preventive healthcare mean to you?
I think in my view, that means taking proactive steps to avoid illnesses before it starts, rather than just treating conditions once they occur. Because it's about education, early education, and fostering a culture of health consciousness to improve awareness and adopt in Nigeria. Because it's actually a combination of several things. You know, the public health campaign, integrating preventative health education into schools, curriculum, deploying mobile health clinics to remote areas, and partnering with local influences like Maurice has just said. You know, it's a whole lot of things, you know. I mean, people tend to actually wait until they actually experience illnesses before they want to take measures to do something. At that stage, I think it would have been too late. So it's all about the awareness of, you know, promoting how people can get better and in themselves, and certain things that individuals themselves can do to avoid and prevent these things, rather than, you know, waiting for it to get out of hand.
So what strategies would you suggest that we do or put in place to improve awareness and adopt this preventive health practices in Nigeria?
Okay, the strategies could be sort of like, let me reiterate. If you say individually, sort of directly speaking to people, maybe by way of what you should eat, the kind of food you should eat, the amount, the time you eat it. You know, some people tend to eat as late as 12 midnight and very large portions. You know, these things are not, you know, it doesn't help anyone. So a lot of people act out of ignorance. So it's a matter of educating them and letting them know, listen, if you eat certain kind of meal, this is what it's going to do to you. If you eat certain kind of meal, like maybe vegetables, salads, and stuff like that, especially for people who are elderly. And when you get to a certain age, it's quite important for you to begin to examine and monitor the sort of things that you do. Lack of exercises, if you see what I mean. And all these things are important to let people know, to take those forms of measure to prevent. And then also to have regular health checks as well. You know, regular health checks, which it brings me to the point where Mr. Tula was saying the sort of things that Atula Health Service wants to bring into play. In the UK, if you permit me to say, because I've lived in the UK for many years. I mean, the way things are run there, under the NHS system, they have a lot of campaigns and stuff, educating people, and then they have the GPs and people strategize within the local reach of the community. So people are assigned to various, you know, registered GPs within reach, that they don't have to travel far, that they can just easily just, you know, at a stroll of work, just get there and access sort of system. Leaflets are everywhere, you know, posters, you know, adverts. So people are well aware and informed. I think those systems need to kind of like
So,
be replicated.
are you saying that is one thing we lack in our communities? We don't have that awareness level?
To an extent, a lot of people are ignorant. They don't know what to do. Apart from the fact that the services themselves are not in place to actually help people combat certain diseases, the awareness of being able to know what is wrong is also another issue. So education is very important by way of signposting people to kind of look inward and as well as seeking help to eradicate.
Now, Maurice, what role can communities and maybe NGOs, civil society organizations play in promoting healthy lifestyle and preventive care?
Well, firstly, let me...
Because she has said that some of these things are lacking in our communities.
Yeah.
So what can we do to ensure that this is down to our grassroots?
Yes, I think the first thing that needs to be done is have a system that encourage early check. Okay? Regular checks followed up like they've had their essential check done, and regularly they now have where they can actually go, because it's early intervention that matters. And this is what we lack at the moment. Because reason why a lot of people, because we've done a study in this country, knowing fully well that majority people cannot access health service because they cannot even afford to go to the doctor.
Now, in all of your community activities that you do, what is that illness that is prevalent in communities? What ailment do you think is prevalent in our communities?
I think the likes of high blood pressure, diabetes,
Non-communicable diseases?
yeah, cancer and all that stuff. This is why earlier on I was saying all this requires awareness and being able to know what sort of lifestyle to keep, balanced diet and stuff like that. So these are prevailing diseases that tend to invade society at the moment. And they're all linked to poor health lifestyle, Yeah, there are some treatable diseases which doesn't directly associate with maybe as a result of how you probably the sort of lifestyle that you've adopted. Say like you had an injury and maybe through accidents and stuff like that, those are different. But anything relating to lifestyle and health, which to an extent for the individual you can control, or shall I not say control, but you can do your best to try and prevent or intervene. It's worth looking into. It's worth looking into.
So how would you rate government's policies and all of this? The tackling non-communicable. The other day we celebrated or commemorated World Cancer Day, and we see that Nigeria alone accounts for, every year we have cases of about 125,000 new cases every year, which means we have cancer cases on the rise in the country. What kind of policies do you think should be put in place to ensure that we address these issues of high blood pressure, we address these issues of diabetes and other non-communicable diseases? I think I'll come to you.
Yes, I think the measures to put in place, the policies, is very important. These policies must ensure that all Nigerians, because early detect and prevention and management, health management must be a priority, meaning that annual health check is essential, because just taking a pinch of your blood into the laboratory and analyze, that can determine what sort of illnesses, and that can prevent it from starting in the first place. because the important aspect is to tackle all this, to have a policy that will give every Nigerian that right to have an health check. And if you look at Nigeria, we have doctor practice all over. But because there is no system that manages the people and the doctor practice, which is easily, this is where the government now have to look at the private partners, but not knowing what to do, and that health situation compounding, and it explodes, and that causes early deaths. I believe the policy, partnership with those that are ready, because there is no need you partner with people that are not doing nothing. You partner with people that have shown initiative, that have system in place. And by so doing, making sure that early intervention is geared at. There is no issue where until when someone gets healed before that person is looked into.
And just to add to that, I think it's down to affordability as well. A lot of people, you know, it's not that they don't know what to do, but they can't afford it. You know, so if it's, you know, like he just rightly pointed out, systems to be in place, policies to make health checks be affordable and cheap as possible for the minority, the people in the urban areas, you know, the community, local areas that cannot afford. What they're introducing, they're starting on a very low scale to be able to reach the masses and people that belong to different grades in life that can't afford it. At least everybody can afford 1,000 naira a month to be able to, you know, start off from there and be assigned to a doctor, be able to go somewhere. You have that confidence that you can approach a particular practice to be able to be checked and all that. It's going to boost people's confidence and, you know, make people become very aware, because affordability is a key point.
Now, talking about affordability, you have stayed in the UK for a very long time. What is health insurance like over there? And what is health insurance like over here?
Okay. Now, the UK, within the UK system, they do have the something called National Health Service, which is sort of like free to everyone. All you need to do is just register, and you're given an identity number that is unique to yourself. And that gives you the access to free health service.
No matter your status?
No matter your status.
Okay.
No matter your status. However, there's a private health service as well. It's disparity, if you see what I mean, in terms of between the rich and the poor.
Okay.
Which is found in every society and every country, you know. It's just like we have two items to be purchased here. One is more expensive and one is cheaper. It depends on where you fall within.
Okay.
The NHS affords free health service. However, the negative that comes with that is the long waiting list.
Okay.
Okay? You'll be put on a waiting list before you get attended to. So now for urgent health needs and people who want to, say for instance, you've been diagnosed with cancer and you want to kind of deal with it ASAP, the issue becomes where maybe you are at in terms of if you're put to wait on the waiting list and your case is urgent. If you have the money, you can go private.
Okay.
So this is the option people have within that community. So it isn't the fact that everybody would have to be under the private healthcare. You have the choice to go through NHS depending on your income and the status where you are.
So whether you're waiting for a long time, you definitely will get the care you deserve.
Of course, you would.
So what do you have to say about Nigeria's health insurance system?
Nigerian health insurance system, I mean, it is... It is a situation. I think I'll leave that for.
Let me comment.
Because he's more conversant with Nigerian operating systems
I think the
than
Nigerian
myself.
government.
Okay.
Okay, we need to create a framework.
Okay.
a framework is very essential that alleviates, okay, the financial burden on people. Because number one, we did a pilot for 2 years in this country. And one thing we understand is there is no framework that elevates, that differentiates the affordability of people.
Okay.
That framework need to be established, okay? Okay? The financial burden, and ensure that even the most vulnerable populations receive the care they need. With this sort of framework, what can you do? You have a framework to check, we call it in the UK, test means. Meaning, if you are working, yes, your test means that you can afford little bit. If you are not working, obviously, but that framework, some professionals must come up with a framework that can really alleviate this aspect. Okay?
So people are means tested,
Yes.
sort of like in terms of their income, what they can afford. Their means are being tested.
Okay.
So
So it means like whatever you earn determine where they place you?
so that they assess you, how much comes into, within your reach.
Okay.
So according to how much you can afford, that's where the subsidy comes in.
Exactly.
They assist you and make up for whatever shortfalls.
So that's the points where we are
You was
lacking
trying to-
here.
Yeah, that is the point, because financial burden, the financial burden is an aspect that no one is looking at. We believe with government partnership coming will give us an avenue to be able to spread nationwide. And I believe we spread nationwide, healthy society, healthy people is healthy nation.
So before I let you go, I would like you to give your last word to Nigerians in terms of preventive healthcare. How do you want to advise them to live their life so they don't come down with this, especially in this economic situation we found ourselves? So I'll start with you.
Yes, I think firstly, our lifestyle, Nigerians. I know it is wrong for somebody to say don't take tobacco, don't take excessive alcohol, don't drink, don't eat unhealthy food. We must look at ourselves. Looking at ourselves as a body, as a human being, we are important to ourselves. That is first. And complementing government effort is that funding must be made available to partner to private providers.
Okay, so let me come to you. What would be your last word to Nigerians in terms of living a healthy lifestyle, especially from where you're coming from, Heightstone? Yeah.
I mean, in the UK, you find people are very much into physical exercise. If you live in a neighborhood, if you look through your window in the morning, early hours of the morning, you probably find about 10 people jogging, jogging and, going, just taking a walk and jogging and all that. So it's just the lifestyle, really. In the UK, people are conscious about what they eat. And maybe because a lot of food there are affordable. They are quite, maybe, you can easily just walk down to the grocery or around the corner shop and pick an item like cauliflower, broccoli, carrots. These things are not that exorbitant, they're not that expensive. Affordable to the, to the minimum. And just checking what they eat and avoiding the likes of maybe alcohol, excessive of it, maybe on social grounds. Once in a while, you can just take a glass
for the stomach's sake.
And so for the stomach. And whilst you're having dinner and all that, it's not too bad. But it's just being conscious,
Okay.
of what you eat, what comes into your body means a lot to build who you are. So it's just that awareness, I would say, to encourage Nigerians to be more conscious. And I know cost is a factor here. And the issue of money. It's significant, and I would plead to the Nigerian government. They're doing a great job at the moment. Congratulations to our president, bringing on board significant health officials who are planning to move things forward. Just for this to be encouraged, and then to help the minorities.
Okay, thank you very much. We have been talking with Maurice Atula, the chairman of the Atula Health Services, and also Victoria Briggs. Thank you so much for your contributions today. And so before we go on to advice, that we encourage you all to take proactive steps towards better health. Until next time, I'm Ogom Izedimbo. Stay safe.